Hello, I'm Dr Andrea. I'm a GP. I work in Claremont in Cape Town at a practice called Brampton Family Practice. I know there's been a lot of uncertainty around COVID-19 and especially now with the vaccine coming out and a lot of unanswered questions. So I'm hoping that I'm going to be able to help answer some of your questions today. Let's talk about the COVID vaccine for a moment. What is a vaccine and how does it protect us? A vaccine is defined as a biological, pathogen-derived preparation that provides acquired immunity to a particular infectious disease, in this case, COVID-19. What this actually means is that what is injected into you is a part of the virus or a protein that the virus needs in order to replicate or make more of itself. Your body sees what's been injected to you as something that's foreign and it mounts an immune response. By your body activating an immune response to this viral element, you are now able to produce antibodies to this viral element. These antibodies remain part of your immune system, and should you encounter this virus in nature, your body now has the tools or the soldiers it needs to fight this virus. A common question I get asked is, why should I be vaccinated? Being vaccinated against COVID-19 not only helps you stay safe and protects you from getting severely ill from COVID-19, but it also helps you from spreading it to others. Because we all know how quickly and how rapidly COVID-19 spreads, it's easy to understand that being vaccinated is the best way to ensure that this virus can no longer be spread around the world. The more people who become vaccinated, the less chance there is of COVID-19 virus being able to find a host and to live in. And as with smallpox, hopefully it will eventually be completely eradicated through vaccination. Many people are concerned about having the vaccine because it's been released so soon after this virus was discovered. The difference with this vaccine and other vaccines is that there were no funding issues when this vaccine was created. There were contributions from all around the world, which means that there were no financial issues holding up the process. There were also researchers from all over the world and scientists from many different countries all contributing to the same thing and putting all their knowledge bases and databases together in order to pull information to make this process as speedy as possible. There were also much bigger trials that were held because a lot more participants were willing to engage with the process, and hundreds of thousands of people have already been trialed on this vaccine, and the safety data was studied over many months before it was released to the public. The safety measures have been very stringent, and all the studies have been done have had excellent safety data and safety outcomes. Side effects have been recorded, but they've all been very mild and very transient, meaning they go away quickly. So what are some of the common side effects that one could expect? Today I'm going to try and answer some commonly asked questions about COVID and the COVID vaccine. So a question comes up asking whether everyone should still go for their annual flu shot as well as have the COVID vaccine, and if so, can that be done at the same time? The answer is absolutely, you should definitely still have your flu shot and the COVID vaccine, but no, they cannot be had at the same time. The COVID vaccine takes about 28 days for it to have its full effect. During this time, your body would need to focus on creating COVID antibodies, so you wouldn't want to confuse it with another vaccine. Aside from this, there's always the potential for side effects, and if you have the flu vaccine and the COVID vaccine at the same time, one wouldn't know if the side effects were from the COVID vaccine or the flu vaccine. Therefore, it is recommended that you wait at least 6 weeks in between the one vaccine and the other. It doesn't matter which one you have first. Questions have been asked about people receiving the vaccine if they have other chronic conditions, whether it's a back problem, kidney problems, heart problems, high blood pressure, diabetes, previous blood clots. The answer is the COVID vaccine is safe. And in fact, in these people with chronic conditions, the COVID vaccine is even more important because they are at higher risk for very severe illness, hospitalization, and more likely death if they do contract COVID. So the COVID vaccine is an absolute must in anybody with other chronic underlying medical issues. Another common concern about the vaccine is whether it will impact on people's fertility. Young people still wanting to have children in the future are worried that they may become infertile after receiving the vaccine. This is not true. The studies have not shown any impact on fertility whatsoever, and in fact the chances are that having a severe COVID infection is more likely to impact a couple's fertility than having the vaccine. Another question which was asked is whether the COVID vaccine is any different to vaccines that babies require or receive. The only difference is that the COVID vaccine hasn't been studied in young children. So therefore, at this stage, it is only safe in people older than 18. Otherwise, the vaccine works in the same way that vaccines do, which are given to children, which is to create antibodies against the illness you are vaccinating against, so that your body can defend itself against that illness if it encounters it out in the world. Someone has raised the question of the fact that when they were little, they were given the incorrect antibiotics, and this caused their deafness and caused their physical disability. Unfortunately, this is a side effect of some medications that were used in the past. These days, however, any vaccine and medication has to go through such strict safety regulations that it is very unlikely for severe side effects such as this to occur. The COVID vaccine has been studied in many different countries and has been trialed on hundreds of thousands of people and has so far not been shown to have any severe side effects. Unfortunately, we don't have data or any information about what will happen in the years to come, but as it stands currently, no side effects causing any disability have been reported.